Well, good morning or afternoon, MRHA listeners. Welcome back to the podcast, The Voice of Rural Health. I have on two special guests with me today from UPMC Western Maryland, Stacy Blank, Community Engagement Coordinator in the Pop Health Department, and then also Heather Miltenberger, Project Analyst in the Pop Health Department as well. Welcome, ladies, and feel free to introduce yourself.
Hello, I'm Stacy Blank. I am the Community Engagement Coordinator for Population Health at UPMC Western Maryland.
Hi, I'm Heather Miltenberger. I am, like you said, the Project Analyst for Population Health here at UPMC Western Maryland.
Well, thank you both for being on today and being special guests on our podcast for our listeners. And I hear that you have a diabetes prevention and diabetes self-management program that you would like to talk about today. Can you please give me an overview of that program?
Sure. The diabetes prevention program, we are new to offering this program here in Allegheny County. It's through, of course, UPMC Western Maryland. Anyone that is eligible for the program, it's 18 years and older. They have to have a BMI of 23 or higher, 25 if Asian. They cannot have a previous diagnosis of type 1 or type 2 diabetes. They can have a history of gestational diabetes, and they need to have one of the three blood tests to show that they have a diagnosis of prediabetes within that range. So that's a hemoglobin A1C, a fasting plasma glucose, or a 2-hour glucose test. That program is a year long, but it is the first 6 months. It is offered once a week for an hour. And then the last 6 months, it's offered once a month for 6 months. So it's really, we like to say it's really about 26 hours. So it's not really a whole lot of your time. And the first 6 months, they really start to talk about your food, healthy eating, healthier food choices, making an action plan. That's something that they ask them to do each class, is what something measurable that you are able to make small changes that can last a lifetime. So that's why it's not, the class is not, done in a week or a month. It's something that we are really pushing, that it does take small changes to last a lifetime. So it is a big ask of people, but the CDC has really shown that people that have completed a diabetes prevention program have lessened their chances of developing type 2 diabetes. Even people that did the participants were still 1/3 less likely to develop type 2 diabetes a decade later than individuals who took a placebo. So instead of, just people taking medicine to try to lower their A1C, actually taking the class, lowering their body weight, increasing their physical activity, which are both two goals of the program that we expect participants to start working on, can really lower their chances of developing type 2 diabetes. So those are the goals of that program. And the diabetes self-management program, of course, that is for people that are diagnosed with diabetes. We have that offered in two different ways. They can do the 1-day 6-hour class with 2 2-hour follow-ups, or they can do 5 2-hour sessions. So it's broken out so they can have a little bit more flexible timing of when they can do it, because a lot of people still work and it's harder to do that. But in that class, they will meet with a registered dietitian, a registered nurse, a pharmacist, a wellness coach, and they will talk to them about their diabetes so they understand what that diagnosis actually means to be a diabetic, how to handle their medications, maybe they're on something that isn't working for them or they're having issues, they can connect them with their primary care to get things figured out. The wellness coach will talk to them about becoming a little bit more physically active, what works for them. And then the registered dietitian, of course, talks about the nutrition, which that seems to be something that is really overwhelming for a lot of people that are diabetics. I know Stacy and I both attended the diabetes self-management training program to actually understand more of what they are learning and what it's like. And it is very overwhelming. It's a lot of information, and I think it's really good for them to ask those questions of the registered dietitian, ask their primary care. They can even do medical nutrition therapy, which we promote that a lot with DSMT. That goes along with it. That is a more intense education one-on-one with you and a registered dietitian. So they can sit down with you and actually go through a meal plan, what to actually pick out in the grocery store. Maybe if you're on a limited budget, healthier ways to be able to stay where you need to be with your diabetes diagnosis. So we have a lot of people here that are willing to help the patient get to where they need to be and have a healthy eating habit, and keep their insulin, their sugar in check. So
thank you for that very robust overview. And it sounds like, there is some challenges, of course, within Allegheny County and surrounding areas that led to, of course, the implementation of these programs. And I think you hit on some of the statistics, but am I correct when I say that?
Yes, you are. We are fortunate enough to be part of a regional partnership for a Catalyst grant to create a sustainable prediabetes, and if you don't already have, diabetes self-management program. So the HSCRC awards those grants, and we're in year 2 of ours, and a regional partnership with Meritus in Hagerstown and Frederick Hospital. The reason that we have these grants, or the HSCRC is developing and awarding these grants, are due to our statistics. If you drill down into it a little further, let's start nationwide. We know that 37 million people, or 11.3% of the population, are diabetic nationwide. We know that 96 million people 18 years and older have prediabetes, or 38% of the population. The biggest statistic with this is that 8 in 10 of us don't know that we're pre-diabetic. If we can offer a pre-diabetes program, we can hope to delay or prevent type 2 diabetes. So that's why that's so important. If we go a little further into Maryland, we know that diabetes is now the 6th leading cause of death in Maryland. We have over 500,000 folks in Maryland with diabetes, or 10.5% of the population. And we have a prediabetes population in Maryland of about 1.6 million, or 34%. Looking a little closer at home now for us, I can give you some statistics in Allegheny County and Garrett County. Allegheny County population, we have 13% diabetes population. Garrett County has 12%. And both of those numbers are exceeding the state numbers, as well as the nation numbers for that, the statistics. And then we don't have an actual number of prediabetes in Allegheny and Garrett County, but we can extrapolate that at least 30% of our residents are pre-diabetic. And our guess is that it's probably much higher, on line with the Maryland population of 34% or higher, we would think.
Thank you for giving me those, statistics. It's always important to tie some statistics to, the program that you have and you're developing and, working on. And it seems like there's a significant challenge. I know personally, there's been family members of mine that have been impacted by diabetes. And so I can see, from my perspective, the issues that we have in the community. And it's great to see that there are some programs available. Could you go a little bit more in depth and tell me, some of the outcomes, some of the successes, and even some of the challenges that you're experiencing right now, whether that would be, with partnerships or referrals, et cetera?
I think one of the the biggest challenge is still is, I mean, we have goals that are expected of us by this grant with the HSCRC. One of the goals for the diabetes prevention program for this year was to have 905 referrals to the program, which is a really large number, especially with just starting a new program that many people don't know about in our community. And then HSCRC actually cut those numbers in half for not just us, but all hospitals that are part of a regional partnership. So just having a continuing number of referrals to come in to be able to start classes, that has been a challenge. So I would say community member buy-in, I would say provider, yeah, provider buy-in has been difficult. Stacy has been continuing to go to new outside providers and specialties and talking to them about both of our programs. A lot of the providers already knew about diabetes self-management training, but it was good for them to hear about it again, just to be refreshed on it. A lot of them didn't even know that people were allowed additional education for diabetes self-management training and MNT, medical nutrition therapy, each year. But yeah, diabetes prevention program, because it's so totally new. Pre-diabetes is not something that you hear about regularly like you do diabetes. So that has been a challenge.
Trying to get that normalized, Jonathan, out in the community has been a big goal of mine as the community outreach person, because, our docs are so busy, as you know, and our providers, when they're trying to see the number of patients. And so, getting them to also remember to talk to them about pre-diabetes is huge. And understanding, getting the community members to understand the wording, that if they say they're, with some of the wording I've heard is they're close to being diabetic, or, they're on the border, I'm telling these folks, you're actually pre-diabetic, there's a word for that. And so I think the more that we normalize talking about that, talking about BMI and weight issues, and trying to do prevention versus management after it already happens, is going to be big and huge to the community when they start talking about it, because we are also reaching out to churches and businesses, any place we really can get a foothold in and talk about it, display our information, work with our community health partners like Mountain Laurel. The last week I was just up in Tri-Town Plaza for your food drop up there for Mountain Laurel, and talking to those folks in line while they're waiting to get their food, a little bit about pre-diabetes and diabetes management programs in the area that they live in is huge, because they just don't know that all the resources are available out there to them.
Yeah, absolutely. I think, prior to coming to the association, my job was, community health, and it's always baffling. And to me, the amount of people that just don't know about the programs that are available to them. And so, community health and community engagement is definitely a very hard task. If, individuals listening to the podcast, whether that would be, of course, our partners and our members, but also, the public, are the ways that they could get involved to assist, or are there a place or a website they could go if they would want to get enrolled into one of the programs?
If anyone is interested in either one of the programs, if they go to our local UPMC Western Maryland website and you look up diabetes or pre-diabetes, we do have something on there where you can put in your basic information and whichever program you would be interested in, whether it's the diabetes prevention or diabetes self-management training, and you can send that to us, and someone from either one of the program will contact you for more information to try to get you signed up for it.
They could also, Jonathan, make a call in if they're interested. We have separate phone numbers for each program that I could share with you now if you'd like.
Yeah, please share it with us, and of course we'll put this in the caption as well.
Okay. For the diabetes prevention program, first of all, they don't need a provider order for that they can self-refer to that. The phone number for that program is 240-964-8424. That number gets them in touch with the community health and wellness programs where that program is housed. And then for diabetes self-management program, that one is run through the Center for Clinical Resources. And that phone number is 240-964-8787.
Great, thank you. And before we finish up, are there any things that are, next steps for UPMC Western Maryland or the program, or anything that you would like to finish on some highlights?
Well, actually, World Diabetes Day is coming up. We are in November, which is Diabetes Awareness Month. But Monday, November 14th is World Diabetes Day. We are asking all of our employees here to wear blue. We will have tables set up in our in the cafeteria where people can come and sign up and give their information if they're interested in one of the programs. If they want to take a pre-diabetes risk test and see where they are, we'll have a healthy snack also for people to get, and of course the World Diabetes Day sticker.
We're offering a $5 coupon to our cafeteria that day if they fill out the risk test or at least come talk to us about our programs. And then we also have Dr. Gameau, one of our endocrinologists, is going to be giving a live talk at noon that folks can register for through the health system website.
Great, those are fantastic. And diabetes, awareness month, we've been promoting it here at the association, and did some work there promoting it for the month. But again, I want to thank both of you for being on the podcast. It sounds like you have a wonderful program, and it's addressing one of the largest challenges, not only here within Western Maryland, but across the country. And we will make sure that all the information that you had sent to me is linked in our caption. And of course, when we launch it on social media, that the information and contact information is all available to everyone. So again, thank you for being on, and tune in next time for another podcast episode.